who needs pelvic inflammatory disease screening. Imagine catching a silent infection before it causes serious problems. That's what screening for bacterial sexually transmitted infections helps us do. While there isn't a specific test for pelvic inflammatory disease itself, testing for infections like chlamydia and gonorrhea is key to prevention. These bacteria are the main culprits behind many cases of pelvic inflammatory disease. Detecting and treating these infections early can stop them from spreading to the upper reproductive organs, which can lead to complications like infertility or ectopic pregnancy. Health authorities recommend that sexually active women under 25 get tested for chlamydia and gonorrhea every year. This is because younger women are more likely to acquire these infections, especially if they have new or multiple partners or don't always use condoms. Women of any age who have increased risk factors should also be tested regularly. These include women with a history of STIs, those with unprotected sex, or those with new sexual partners. Pregnant women who are at high risk should be screened early in pregnancy and again in the third trimester to protect both mother and baby. Testing involves simple swabs or urine samples to check for chlamydia and gonorrhea. If these infections are found, prompt treatment can prevent the bacteria from ascending and causing pelvic inflammatory disease. It's important to remember that diagnosis of pelvic inflammatory disease is mainly clinical, based on symptoms like lower abdominal pain or cervical tenderness. But testing for these bacteria guides treatment and helps prevent long-term damage. Screening for other STIs like HIV and syphilis is also recommended when pelvic inflammatory disease is diagnosed. This comprehensive approach ensures better sexual health and reduces the risk of complications. Routine testing for bacterial vaginosis isn't generally recommended unless symptoms are present, as its role in pelvic inflammatory disease is less direct. In the end, early detection through regular screening is the best way to prevent pelvic inflammatory disease and protect reproductive health. If you're sexually active, talk to your healthcare provider about your risk factors and screening schedule. Remember, everyone's situation is different, so personalized advice from a medical professional is always the best course. Taking these simple steps can make a big difference in your health and future.